A urinary tract infection, or UTI, causes more than 8 million visits to the doctor each year. You'll be surprised to learn that 60% of women and 12% of men will have at least one UTI during their lifetime. Hi viewers, and welcome back to Bestie. The role of your urinary tract is to make and store urine. Infections can happen when bacteria overcomes your body's defenses in the urinary tract. They can affect your kidneys, bladder, and the tubes that run between. It's very important to know the signs of a UTI so that you can take care of it before it becomes serious. And in today's video, we'll tell you what the signs are. Plus, we'll talk about causes, diagnoses, treatment, and prevention. From frequent urination, lower back pain, cloudy urine to behavioral changes and more, watch till the end to learn about all of them. Your urinary tract can be divided into two parts, the upper and lower urinary tract. The upper tract consists of the kidneys and ureters, and the lower tract consists of the bladder and the urethra. Number 1. Frequent urination. When you have a UTI, the lining of the bladder and urethra become red and irritated, just as your throat does when you have a cold. The irritation can cause pain in your lower abdomen or pelvic area and even the lower back, and will usually make you feel like urinating more often. Burning or pain when urinating is the most common symptom. You may feel a strong urge or need to urinate but only get a few drops. This is because the bladder is so irritated it makes you feel like you have to urinate, even when you don't have much in your bladder. At times, you may lose control and leak urine. Which drinks make you urinate frequently? Tell us quickly down below in the comment section. Number 2. Cloudy or smelly urine. Healthy urine is clear and doesn't have a strong odor. Cloudy or foul-smelling urine could be a sign of an infection in your kidneys or another part of your urinary tract. One study found that about 8% of people with acute kidney stones had a urinary tract infection. Cloudiness is a sign of pus. The smell can come from the bacteria that cause urinary tract infections. An odor may also come from urine that's more concentrated than normal. Number 3. Behavioral changes. A urinary tract infection may cause certain behavioral changes in elderly adults, like confusion, agitation, and disorientation. Such symptoms are often categorized as delirium. People with age-related issues such as delirium or dementia are especially at risk of developing a more severe UTI. This is because they may not be able to communicate their symptoms, which means they won't get treatment as quickly as they need. Although this connection between UTIs and delirium has been established, the reason why delirium may occur in elderly adults with a UTI is not yet known. Number 4. No symptoms. Symptoms of UTI can vary, and it's not entirely uncommon for someone to experience no symptoms. It's estimated that about 1 to 5% of younger women experience a condition called ASB, which is a UTI without the classic symptoms, also called asymptomatic urinary infection. While it's unclear why the bacteria involved with urinary tract infections sometimes won't cause symptoms, instances of symptom-free UTIs increase with age. Up to 16% of women older than 65 have been found to have ASB, and that number grows to almost 20% for women over 80. Other factors that increase your chances of an asymptomatic UTI are urinary catheter use, spinal cord injuries, and diabetes. Number 5. Symptoms in children. UTIs are the second most common type of infection in children, behind ear infections. Unfortunately, early symptoms in young children are not always apparent, and sometimes there are no symptoms at all, or the child is simply unable to articulate the problem. When it comes to babies under 2 years old, parents need to be aware of the signs of infection. These include fever of 104 degrees or higher, which is the most common symptom of UTI during a baby's first 2 years. It may also cause jaundice. Up to 18% of babies with prolonged or worsening jaundice also have UTIs. When jaundice occurs 1 full year after birth, it's a strong indicator of infection. Your baby may also feel sluggish, be sick with nausea or diarrhea, and cry while urinating. Meanwhile, older children generally have similar symptoms to adults, including urgency, cloudy urine, and pain during urination. For children who've already been toilet trained, bedwetting is also a sign of a UTI. How exactly is a UTI diagnosed? Diagnosis of a urinary tract infection is based on symptoms, medical and surgical history, medications, habits, and lifestyle. It's common for a doctor to ask about sexual history and any instances of previous UTIs. A physical examination and lab test will complete the evaluation. A sample of urine might be requested in order to confirm a diagnosis of a urinary tract infection. Dipstick analysis may be done first. This quick test entails dipping a small chemical strip into a urine sample, then looking for certain color changes on the strip, which may indicate abnormal levels of blood, sugar, or bacteria. If an upper urinary tract infection is suspected, the doctor may also recommend a blood test. People suffering from recurring urinary tract infections may be given additional tests to see if there are any obstructions or abnormalities. Such tests can include an ultrasound of the bladder and kidneys, a CT scan, or an MRI for a more detailed analysis of the urinary tract. You may also be recommended a cystoscopy, in which a small camera is inserted through the urethra to see inside the urethra and bladder. Did you know that there are signs that can help you detect bladder problems at an early stage? To know what they are, watch this video titled 8 Signs of an Unhealthy Bladder You Can't Ignore. Now back to symptoms of a UTI, its diagnosis, prevention, and treatment. What causes a UTI? Your urine is normally sterile. An infection occurs when bacteria gets into the urine and begins to grow. The infection usually starts at the opening of the urethra where the urine leaves the body and moves upward into the urinary tract. Bacteria may even travel up to the kidneys, but no matter how far it goes, bacteria in the urinary tract can cause problems. Just as some people are more prone to colds, some people are more prone to UTIs. Women are more likely to get a UTI than men because women have shorter urethras, so the bacteria have a shorter distance to travel to reach the bladder. Treatment? Treatment of UTIs depends on the cause. Your doctor will be able to determine which organism is causing the infection from test results. Number 1. In most cases, the cause is bacteria. UTIs caused by bacteria are treated with antibiotics. In some cases, viruses or fungi may be the cause. Viral UTIs are treated with medication called antivirals. Fungal UTIs are treated with medications called antifungals. Number 2. The form of antibiotic used to treat a bacterial UTI usually depends on what part of the tract is involved. Lower tract UTIs can usually be treated with oral antibiotics. Upper tract UTIs require intravenous antibiotics. Number 3. Sometimes bacteria develop resistance to antibiotics. To reduce your risk of antibiotic resistance, your doctor will likely put you on the shortest treatment course possible. Treatment typically lasts no more than 1 week. Number 4. Results from your urine culture can help your doctor select an antibiotic treatment that will work best against the type of bacteria that's causing your infection. Number 5. Treatments other than antibiotics for bacterial UTIs are being examined. At some point, UTI treatment without antibiotics may be an option for bacterial UTIs. This can be done by using cell chemistry to change the interaction between the body and the bacteria. Is there any way you can prevent UTIs? Here are some tips to reduce your risk of urinary tract infections. Number 1. Drink water. Drinking water helps dilute your urine and ensures you'll urinate more frequently. This will allow bacteria to be flushed from your urinary tract before an infection can begin. Number 2. Drink cranberry juice. Although studies are not conclusive that cranberry juice prevents UTIs, it probably won't hurt. Number 3. Wipe from front to back. Doing so after urinating and after a bowel movement helps prevent bacteria from spreading to the vagina and urethra. Number 4. Empty your bladder after intercourse and drink a full glass of water to help flush bacteria. Avoid potentially irritating feminine products. This is because using deodorant sprays or other feminine products such as douches and powders in the genital area can irritate the urethra. Number 5. Change your birth control method. Diaphragms or unlubricated or spermicide-treated condoms can all contribute to bacterial growth, so be careful when you use them. While recognizing early signs can help treat a UTI, there are other diseases whose early predictions can help do the same thing. Learn more by learning about health symptoms women should never ignore, or finding out unusual symptoms of diabetes. These 2 videos will definitely help you better understand symptoms of certain diseases better so that you can take early action. So go ahead and pick a video, or watch them both for maximum benefits. Have you ever had a UTI? What symptoms did you have? Let us know in the comment section below.